they asked me to talk about some of the research. And not surprisingly, the NSDA has actually been involved in a lot of these research projects. And as you know, we don't have a lot of money, but we do have enough to help support some startup grants, and many of them have actually turned into really, really exciting NIH studies. So I wanted to go over kind of the NIH portfolio. A lot of it is very technical, and I apologize if it seems like this is really technical stuff, but there's probably a better way to simplify it. But I'm going to tell you the way that it's functioning right now, and I think that way you'll maybe get a better understanding of what's happening. So I've kind of divided them generally into categories that the NIH seems to be funding with respect to SD research. And so the first category is psychosocial. There's really only one grant from Dr. Bailey from the University of Washington. And basically, it's an instrument that they've developed to help evaluate and ameliorate some of the participation restrictions faced by adults with chronic neurologic speech and voice disorders. And it's a good grant because obviously patients with SD experience a lot of these issues, and it's important that the NIH start to study some of them. So there's a number of grants, not a lot, that are really discuss peripheral neuromotor control. That is to say, they're kind of studying the larynx, the way the larynx is behaving in patients that have spasmodic dysphonia. So there's one from California from one of my associates there. That really is kind of just studying the laryngeal muscles and their shape and the voice and the airflow and their vibration. This is a canine study that is studying electrophysiology. There's another one by Jack Jiang, who's at the University of Wisconsin, a very well-known researcher that frequently gets money to it. And he's actually studying the aerodynamics. By aerodynamics, I mean he's looking at the pressure beneath the vocal cords and the amount of flow that's occurring through the vocal cords in patients with spasmodic dysphonia. And in the blue there at the very bottom, I've kind of outlined to some extent what's going on. It says, pre and post-treatment aerodynamic assessment will be performed to determine the effect of Botox on spasmodic dysphonia. Projects 2 through 4 address the development of internationally acceptable and rigorously validated diagnostic criteria. But it's purely an aerodynamic study to kind of look at what the pressure and flow characteristics are in patients with spasmodic dysphonia. There's a study that is kind of an interesting study by Kara Stepp, which is a study at Boston University. And what they've done is they've developed an acoustic measure, that is to say, a measure that they can develop just by recording patients. And they've validated this measure to that it will actually demonstrate how much tension is in the larynx. So now they've gone back and using this measure, they're starting to look at patients with spasmodic dysphonia. And so this is an acoustic estimate of laryngeal tension, basically based upon just the frequency of somebody's voice, which has shown promise across a range of voice disorders associated with laryngeal tension. And of course, spasmodic dysphonia is one of those. So there's, again, a few studies that are looking at central neuromuscular control, and kind of as we're getting into the depth of it, it gets to be a little bit more difficult to really kind of understand what a lot of these projects are doing. So there's Teresa Kimberly is here, and so I'm not going to discuss Teresa's project because she's going to talk to us about it, but it's a very good study that's being funded by the NIH. But I am going to talk about some of the other ones that deal in this area. One entitled Neuroplasticity and the Role of Sensory Motor Cortex in the Control of Oral Facial Function, which is a study from the University of Chicago. that basically is looking at the way jaw muscles, larynx, and tongue musculature all function to kind of initiate one another. And it seems to be a little bit off the subject of spasmodic dysphonia in general, but nevertheless, it's a kinetic study, and it does have some relationship to what's happening in terms of dystonic changes in some of the muscles of this area. So brain networks in dystonia, Christina Simonian, who has also been a researcher that has been supported by the NSDA, has a study entitled Brain Networks in Dystonia. And basically, she mentions that there are these task-specific primary focal dystonias, she calls them TSPFDs, which are characterized by selective activation of dystonic movements during the performance of highly learned motor tasks, such as writing dystonia, playing a musical instrument, speaking, or even singing. And it's basically a study to try and understand some of these task-specific dystonias that are occurring. And so it has two specific aims. Number one, determine distinct features of brain functional network abnormalities underlying task specificity in different types of dystonias. And two, establish structural correlates of functional neuroimaging abnormalities during these task-specific dystonias. And so she's a very good researcher, and her work is very good, and I think the NSDA should be quite proud that they've been able to help her get to this level. Another one entitled Neuromodeling and Imaging of Speech. This is by Frank Gunther, and it's a Boston University study as well. And the primary aim is to improve the mapping between functional modules in the DIVA model and neural substrates. So you're saying, what the heck is he talking about here? Which is kind of what I said when I first read that as well. But there is a very sophisticated mathematical model called the DIVA model. And the DIVA model actually is almost a mathematical model that looks at different areas of the brain and can kind of calculate how the various areas, the cerebellum, the thalamus, the cortex, help to control speech. And so it looks at pretty much the way that sensory input to this model modulates the way the DIVA model functions. And so what he's trying to do now is to break out spasmodic dysphonia and see how he can get patients with SD to match the DIVA model, because it's a very well understood model, and they feel as though if they can get a good correlation between SD and what's happening in the DIVA model, they can come to some realization of how to better help patients. Now, we'll come back to that later, because believe it or not, there are more studies that deal with these models of speech formation. So moving on to what I would call abnormal CNS inhibition. And this seems to be a very ripe area right now. And there's quite a few really good studies that are looking at this as well. And this one is called Pathophysiology of Basal Ganglia Disorder by Mark Hallett. And he's an extremely good researcher. And basically, an important type of defective inhibition is surround inhibition, where muscles and movements not desired by the task need to be inhibited. And this lack of inhibition leads to motor overflow and action dystonia. So it's postulated, and there seems to be good evidence for that, that when we produce a task-specific speaking to you, that not only is an area of the brain excited that allows us to carry that forward, but there are other areas of the brain that are inhibited to some extent, so that we actually have good graded control over the way we're speaking. In some patients with spasmodic dysphonia, this area of inhibition seems to not be functioning properly. And by using very sophisticated magnetic stimulation techniques and functional MRI, they can actually look at these areas of the brain in patients with spasmodic dysphonia and try to get some idea of how this disinhibition is functioning. And of course, the Dystonia Coalition is collaborating with a lot of these researchers. So moving on to almost something that's pretty similar to that is called sensory interaction. And I think this is a very interesting area of research as well. So Michael Hammer is also a supported researcher from the Spasmodic Dysphonia Association. And you can see there's a lot of blue here. But basically, in a way, I'm trying to summarize his work because I've seen some of the initial grants. He's developed a model where he's demonstrated that patients with spasmodic dysphonia have a different response than normal patients to sensory input at the level of the glottis. So he actually blows air on the vocal folds, and he can demonstrate that patients with SD, the sensory input from the air that's causing a sensory change, they react quite a bit differently than normal patients do. And so looking at his two specific aims, he says to determine if mechanosensory monitoring is modulated during voice production and how it interacts with the auditory feedback to expand our understanding of the vocal sensory motor input, and two, to define the association between voice in the presence of laryngeal sensory input based on our preliminary clinical data, voice-related sensory monitoring with voice severity and voice improvement in AD and Parkinson's disease as well. So we hypothesize that mechanico-sensory monitoring is modulated during healthy voice production and interacts with auditory feedback to maintain the voicing, and that they hypothesize that abnormal sensory monitoring is uniquely associated with voice disturbances in adductor spasmodic dysphonia and Parkinson's disease. And so it's when I first read it, I kind of thought, oh, this doesn't seem like it could be possible, but indeed his data is very compelling, and it's actually a good study. Another study, which is not all that dissimilar, is entitled Neuroimaging of Speech Motor Control. And this is by John Hood, who is at the University of California, San Francisco. And there's a team of researchers there that actually have 3 or 4 NIH-sponsored grants, and some of them are actually specifically tailored to the study of spasmodic dysphonia. And this gets back to the DIVA model that I was just talking about, but without wasting a lot of energy and time on it, they have actually proposed a different model, which they call the SFC models, the State Feedback Control Model. Another study, which is not all that dissimilar, is entitled Neuroimaging of Speech Motor Control. And this is by John Hood, who is at the University of California, San Francisco. And there's a team of researchers there that actually have 3 or 4 NIH-sponsored grants, and some of them are actually specifically tailored to the study of spasmodic dysphonia. And this gets back to the DIVA model that I was just talking about, but without wasting a lot of energy and time on it, they have actually proposed a different model, which they call the SFC models, the State Feedback Control Model. And in this model, instead of having a mathematical model that shows input and how all these things are affecting it, their model is a little bit different because it's based entirely on feedback control, that is to say, sensory control. But the feedback that it's based upon comes from a surrogate called an observer that is only indirectly affected by real sensory feedback. So somewhere apart from us, we have this mental image of how we want to speak. And then this mental image is actually affected by sensory feedback, and that affects the observer and ultimately affects the way that our voices are working. So really there's kind of a competition between some of the DIVA proponents and this FFC proponent to see which one of them more accurately defines the way that we communicate with one another. And in so doing, they believe that they can get a better insight into the abnormalities that are occurring. And he's actually developed a number of studies that are significant in that regard. So another study from the same institution by John Howard and the other researchers in his group is called The Timing of Neural Activity in Spasmodic Dysphonia. And I apologize if it seems like it's getting pretty dense here, but this is what is being proposed. He's saying from our model, the SFC model, we conclude that inferring functional impairments in spasmodic dysphonia from aberrant CNS activity requires knowing more than where in the CNS the aberrant activity is occurring. In other words, he's saying it's not enough just to know where in the brain it is. It also requires knowing when in the act of phonation, for example, initial glottal movement or voice onset, it is occurring. Herein we propose and address this issue. So they have a couple different specific games, but basically what they're studying is the timing component that's actually happening, how the areas of the brain are communicating with one another in order to produce this aberrant state. Imaging, we're actually coming towards the end, believe it or not. Imaging sensory motor adaptation and compensation of speech. This is from the same group in San Francisco. In this grant application, we extend a quantitative model for speech motor control called the SFC model that we have previously developed. The SFC postulates that the brain controls speech using internal prediction of the state of the vocal tract and sensory consequences. And so this is another grant to kind of look at how the SFC model might be affecting patients with spasmodic dysphonia. And I should say that the NSDA has actually funded now a pilot study to look at the same thing in patients with tremor, which is actually, I think, the first study that I've actually seen that is going to use some of these same techniques to actually look at patients that are suffering from tremor as well. Genetics of ST. This is the area that has gained a lot of interest in recent years. And obviously the Dysphonia Coalition has been working on this for some time. And they have a number of projects and a DNA repository as well as a brain repository that they're looking at and trying to map different genetic defects that are occurring in patients with dystonia and even spasmodic dystonia specifically. And another genetics one that Christina Simonian is, and this has been also supported by the NSDA, entitled Imaging Genetics of Spasmodic Dysphonia. This is an interesting grant in that it's trying to identify specific brain issues that are occurring in patients with spasmodic dysphonia and trying to determine whether or not there are certain genetic characteristics that are contributing to these abnormalities, trying to match up the inheritance that occurs in some patients with SD with some of the abnormal brain function that they're not able to demonstrate. So treatment. Now you would expect that there would be this whole slew of NIH studies that are looking at treatment of patients with spasmodic dysphonia, but the reality is there's only one right now. And this is a grant also from Christina entitled Central Mechanisms in Treatment Response. And really they're looking at this drug oxybate, which has been demonstrated to be very similar to the effects of alcohol on spasmodic dysphonia. And they're looking at it with SD and with vocal tremor as well. In addition to that, there is another study that the NSDA is helping to support in Canada that's now looking at deep brain stimulation for spasmodic dysphonia. It's a pilot study, but it has shown some promise in patients that have Parkinson's disease or other dystonias and thalamic stimulation in terms of relief of their symptoms. Unfortunately, when I first looked at the study, and I might as well say this, I wasn't totally sold on it because many patients that undergo deep brain stimulation have speech issues. afterward, because the electrodes go very close to the speech center. So I don't think everybody here should rush out and sign up for deep brain stimulation yet. Let's wait till it finishes. So I think that's my summary of some of the NIH studies that are ongoing. And you can see there's a lot of really important work going, and hopefully some of this will turn into better treatments for all patients.